Strep throat is a common bacterial infection that affects people of all ages, but it's especially prevalent among children and teenagers. Recognizing the early warning signs is crucial for timely treatment and preventing complications. In this video, we'll walk you through the initial symptoms to watch for, how they differ from other sore throats, and why early detection matters. Let's start by understanding what strep throat is and why it's important to spot it early. Strep throat is caused by a type of bacteria known as Streptococcus pyogenes or group A Streptococcus. This bacterium is highly contagious and spreads through respiratory droplets when an infected person coughs or sneezes. Understanding the cause helps us better appreciate why certain symptoms appear and why quick action is necessary to prevent spreading the infection to others. Catching strep throat early can make a significant difference in recovery time and reduce the risk of complications, such as rheumatic fever or kidney inflammation. Early treatment with antibiotics can also help prevent the spread to others in your household or community. That's why knowing the warning signs is so important. One of the earliest and most noticeable signs of strep throat is a sudden, severe sore throat. Unlike a mild scratchiness that comes with a common cold, the pain from strep throat often appears quickly and can make swallowing very uncomfortable. If you or your child experiences a sore throat that seems to come out of nowhere, it's worth paying attention. Another early warning sign is a throat that looks red and swollen. When you look in the mirror or use a flashlight to check, you might notice that the back of your throat appears inflamed. This redness is a sign that your body is fighting off an infection, and it's often more pronounced in strep throat than in viral sore throats. Classic sign of strep throat is the appearance of white patches or streaks of pus on the tonsils or at the back of the throat. These spots are not always present, but when they are, they're a strong indicator of a bacterial infection rather than a viral one. If you notice these white areas, it's a good idea to consult a healthcare provider. Some people with strep throat develop tiny red spots known as petechiae on the roof of the mouth. These small dots can be a helpful clue for doctors when diagnosing strep throat, as they're less common in other types of throat infections. Swollen, tender lymph nodes in the neck are another early warning sign. These glands may feel like small lumps under the skin and can be sore to the touch. Swelling occurs as your body's immune system responds to the infection, and it's a common symptom in strep throat cases. A sudden fever, often accompanied by chills, is frequently seen in strep throat. The body raises its temperature to fight off the bacteria, and this can make you feel hot, sweaty, or shivery. Fevers with strep throat are usually higher than those seen with a common cold. Many people with strep throat experience headaches as an early symptom. This pain can range from mild to severe and is often accompanied by other symptoms like fever and sore throat. Headaches may be more pronounced in children, making them feel especially uncomfortable. A decrease in appetite is another early sign, especially in children. The pain from swallowing and the general feeling of being unwell can make eating less appealing. If you notice a sudden drop in appetite along with other symptoms, it could be a warning sign of strep throat. Some people, particularly children, may feel nauseous or even vomit in the early stages of strep throat. This is often due to the body's response to infection and the discomfort caused by other symptoms. If nausea or vomiting is present with a sore throat and fever, strep throat could be the cause. Feeling unusually tired or weak is a common early symptom of strep throat. The body uses a lot of energy to fight off the infection, which can leave you feeling drained. This fatigue often appears before other symptoms become severe. Interestingly, one of the clues that a sore throat might be caused by strep rather than a virus is the absence of a cough. Most people with strep throat do not have a cough, which helps doctors distinguish it from other respiratory illnesses. Strep throat symptoms often come on quickly, sometimes within just a few hours. This rapid onset is different from viral infections, which tend to develop more gradually. If you notice a sudden cluster of symptoms, it's a good idea to monitor closely. Painful swallowing or odonophagia is a hallmark of strep throat. The pain can be sharp and make it difficult to eat or drink. This symptom is often more intense than what you'd expect from a common cold. In some cases, strep throat can cause a red, sandpaper-like rash known as scarlet fever. This rash usually starts on the neck and chest before spreading to other parts of the body. If you notice a rash along with other symptoms, it's important to seek medical advice. Generalized body aches and muscle pain can also be early signs of strep throat. These aches are your body's way of signaling that it's fighting off an infection. The discomfort may be mild or more pronounced depending on the individual. Hoarseness or difficulty speaking can sometimes occur with strep throat, especially if the throat is very inflamed. While not as common as other symptoms, it can be an early warning sign, particularly if it appears alongside a sore throat and fever. Some people with strep throat report pain that radiates to the ears. This is due to the close connection between the throat and the ear canals. If you notice ear pain along with other symptoms, it could be related to strep throat. Bad breath or halitosis can be an early sign of strep throat. The bacteria responsible for the infection can produce unpleasant odors, especially when combined with pus or white patches in the throat. Young children with strep throat may not be able to describe their symptoms clearly. Instead, they might become unusually irritable, fussy, or withdrawn. Paying attention to changes in behavior can help catch strep throat early in kids. Stomach pain is another symptom that can appear early, particularly in children. This discomfort may be accompanied by nausea or vomiting and is often overlooked as a sign of strep throat. Unlike many viral infections, strep throat usually does not cause a runny nose. The absence of this symptom can help distinguish strep from other illnesses like the common cold or flu. If a cough is present with strep throat, it's usually mild and not the main symptom. This is another way doctors can differentiate between strep throat and viral infections, which often feature a persistent cough. Enlarged or swollen tonsils are a common early sign of strep throat. The tonsils may appear red, swollen, and sometimes have white patches or streaks of pus. This swelling can make swallowing even more difficult. Tenderness or pain under the jaw where the lymph nodes are located can be an early indicator of strep throat. This area may feel sore when touched or when moving the neck. While rare, severe swelling from strep throat can sometimes make breathing difficult. If you or someone you know experiences trouble breathing along with other symptoms, seek medical attention immediately. A dry, scratchy feeling in the throat can sometimes be an early sign of strep throat. This sensation may precede more severe symptoms like pain and swelling. The discomfort from strep throat symptoms can make it hard to get a good night's sleep. Pain, fever, and general malaise may keep you or your child awake, especially in the early stages. Changes in the voice, such as hoarseness or a muffled sound, can occur if the throat is very inflamed. While not always present, these changes can be an early warning sign, especially in combination with other symptoms. Because swallowing is painful, people with strep throat may drink more fluids to soothe their throat. Increased thirst can be an early sign, especially if accompanied by other symptoms. A general feeling of being unwell or malaise often appears early in strep throat. This can include a combination of fatigue, aches, and a sense that something isn't right, even before more specific symptoms develop. Strep throat symptoms can worsen quickly, sometimes within a day. If you notice that symptoms are getting worse rather than better, it's a sign that medical attention may be needed. Some people with strep throat report an unusual or metallic taste in their mouth. This can be due to the infection itself or the presence of pus and bacteria in the throat. Cold drinks may cause increased discomfort for those with strep throat. Sensitivity to temperature, especially cold, can be an early warning sign that the throat is inflamed. The combination of pain, fever, and fatigue can make it hard to focus or concentrate. This mental fog is a common early symptom, especially in children and teenagers. Restlessness or an inability to get comfortable can be an early sign of strep throat, particularly in children. This may be due to pain, fever, or general discomfort. Excessive sweating, especially at night, can occur with strep throat as the body tries to regulate its temperature. This is often seen alongside fever and chills. Shivering or feeling cold even when the room is warm can be an early sign of strep throat. This is the body's way of trying to raise its temperature to fight off infection. A sore throat that appears without other typical cold symptoms, such as sneezing or a runny nose, is more likely to be caused by strep. This distinction can help you decide when to seek medical advice. If you or your child develops a fever without an obvious cause, especially in combination with a sore throat, it could be an early sign of strep throat. Unexplained fevers should always be monitored closely. Strep throat can spread quickly in close contact environments like schools or families. If several people in a group develop similar symptoms at the same time, strep throat could be the culprit. If you notice several of these early warning signs, especially a sudden severe sore throat, high fever, or difficulty swallowing, it's important to consult a healthcare provider. Early diagnosis and treatment can help you recover faster and prevent complications. To sum up, recognizing the early warning signs of strep throat can help you seek treatment quickly and avoid spreading the infection. Remember to practice good hygiene, such as washing hands frequently and avoiding close contact with sick individuals. Stay alert to the symptoms we've discussed, and don't hesitate to seek medical advice if you're concerned.